Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
That's the number one problem. If you have a situation like that that is so inflammatory, then steps need to be taken immediately to ensure that the rest of the world is protected. That was not done. And it's not clear that there are safeguards that would prevent it from happening again. Any commentary on China and its history? That's the largest populated country in the world.
I did some work in China, and it was quite an experience, but it was also frightening because everything is so controlled by the government. I mean, there's no real freedom of movement, freedom of speech, none of that. So even as foreigners, as guests, and I was a guest of the Chinese government doing this work, you could not veer off the path that they'd set for you. So I can clearly understand how they would control any messaging, any information or whatever.
Yeah, the question is, how do you overcome that? Because the next pandemic could be the same kind of thing. Of course, it depends which country it begins in. But if it begins in China, that is so extensive that it is, I don't know any steps you can take to keep it from recurring.
Well, the thing is too, is that people are expendable there because there's so many of them. Unlike here, I mean, there's just a whole different value placed on human life. So I think that's maybe the root of it. And then you don't have any real religious underpinning. And I think that that's one of the things, although it goes haywire here sometimes, but I think that's one of the underpinnings that we have here is a religious underpinning or spiritual underpinnings, and they don't exist there.
You know, Dr. Callender, we have whistleblower protection in this country, but I think they don't have any whistleblowers in China.
Any what?
Whistleblowers.
Oh, they're not allowed.
That's my point. And so if something happens over there, nobody's going to say anything for fear of death. In this country, they're passing laws as we speak about protecting whistleblowers.
Good.
Had to.
So if somebody does something in a lab, like I'll give you a good example. When they were working on Dolly, that sheep, and they were doing a lot of cloning, the word got out. The word got out that what they were doing in the class.
Yeah. Well,
it was in place, but the last administration just totally disregarded them as far as the whistleblowers were concerned. And many of the whistleblowers were fired or otherwise punished, not put in jail, but retribution. Lost careers, etc. So even here, it hasn't worked as well as it should. So I'm glad that they're putting more safeguards in.
Yeah, you're right, because that was Trump that did that.
Mm-hmm.
As far as China is concerned, I remember early on when they were reporting the deaths from COVID, countries in Eastern Europe and the other Asian countries reported thousands and thousands and then tens of thousands of deaths due to COVID. In China, I think at the last report that I saw, they had like 4,600 deaths. And so I don't know if we can trust that. I doubt it. but we'll never know what the actual numbers are because of that secrecy that they have.
Yeah.
But one other aspect though is if the virus was controlled, it was because of the government control. Because government says you wear a mask, you have to wear a mask in China.
Yeah.
I mean, there's no getting around that.
Well, the only question is, what can be done so this wouldn't happen the second time?
Well, the article alluded to that there's really nothing you can do, or did they? I'm looking at it now. Was there a resolution to it?
Well, and they don't offer a solution because that's one of the problems of the study, is that it doesn't identify who to hold accountable, nor does it identify ways to hold people accountable. That's one of the flaws of the study. Although in many ways, that's why they could get to the truth, because they didn't name names and didn't hold people accountable. But that, in a way, is one of the greatest weaknesses of the study. And in order to prevent the second pandemic, they would need to take steps that would overcome that innate tendency to hide things and put everything under the covers until it's too late. And so this is just the beginning, because this just identifies the mistakes, but it doesn't identify who were the problems, except it does identify China. But they don't identify what to do about China. Do about any country that has a virus like that and wants to hide it. And they did identify the steps that the Chinese took to keep it from becoming public. And there were a number of steps that it took to keep things secret. And so there's an opportunity for WHO to look within itself, because this is one of the things that Trump was incensed about, was that he felt that it occurred in China and steps were not taken to let people know about it in time. And that is accurate. I think that this panel identifies that is the first problem. Any other thoughts about that aspect of it? Because that's just the first part of it. The next part is after finally the details were out, taking steps in each country. And most countries did not take advantage of the notice when they got it, to take great steps, including the United States, to protect its people. And this is a second item that, in other words, what do we do? I think we should have a plan in place. Remember, first Trump denied there was a plan. Right. And then it turned out there was a plan all the time, but he chose not to pay attention to it. And so how do we protect against that kind of thing happening again in the United States? And how do we respond more aggressively and successfully? Remember, we had the situation where I think it was Fauci and others who said you didn't need to wear masks. And of course, that was a big mistake. And then mistakes intensified. Testing was inadequate.
Well,
go ahead, Darryl.
Looking at it from a high level, I think what you need is international diplomacy. And so it's really not a head of state conversation, but it's a head of state initiated initiatives, because like what you need is sharing of intellectual property, and the diplomacy says that you have different international regulations in place in exchange for sharing intellectual property. It's in everybody's best interest to to share development of medical technologies to combat pandemics. And in exchange with, I mean, that's in China's best interest, any country over the world. You just don't want to be in line to get your vaccines, depending on how much cash you have, because whether people are expendable or not, they're a resource. You got to protect your resources. So it's not something that can be done quickly, but it's I'm hopeful that head of states have it on their radar, and so they're trying to get support within their own countries for a plan to actually share intellectual property, and so that if you develop cures for different medical issues, that they're just not 100% vaccine protected, where you got to pay to play.
And the other thing was that the Chinese intentionally falsified how the virus was transmitted. And they knew better, but they falsified it. And that allowed. So this goes along with the same concept that you're talking about. How do you have that kind of international policy that holds people accountable for doing what is the right thing?
Let me write it down.
It's kind of like the Iran nuclear agreement. With that plan, you had inspectors on the ground, international inspectors monitoring it, and so you just don't rely on false reports coming from Iran or China. But that's what it involved. It would involve international inspectors on the ground.
Yeah, you're right, and it means that you'd also have to have that mandatory,
No.
because otherwise it wouldn't work.
Dr. Callender, in my experience at the NIH, I've done a couple of summer fellowships over there. I'd say maybe a quarter to a third of the scientists that I saw were from China. And I don't know if they were on loan or whatever, but a lot of them came here and are here for training in medicine and research in all the institutions in Bethesda.
Well, what it says is that they know better. But because they know better doesn't mean that they are going to act better. And so we need to have a way of making sure that happens. And that's the challenge. That's the challenge. The second thing that they talk about is after you have the vaccine, how do you establish equity in administration of the vaccine? Which is easier said than done because we have that problem here. So how do we do that? It's easy to talk about it. It's another thing to do it. Anybody have any thoughts about that aspect of it?
Dr. Callender, you said equity in administration of the vaccine. Is that what you're?
Yes, that's correct.
I think it's impinging upon the local governments, like in DC. I think Muriel Bowser is very on point as far as getting vaccines out to people who can't travel to the vaccination sites, opening community vaccination sites where everybody can get the vaccine. I think that's a big thing. Just heard yesterday, Uber and Lyft are now giving free rides to vaccine sites, and that's covered. So it takes it takes a lot of initiative on the part of the local you know, like Darryl was saying, the ground, you know, the ground roots people to make it equitable, to get it to everybody, you know.
Yeah.
And the other part of equity is how about those countries that don't have the funds to pay for the virus?
Yeah.
Exactly. And then
Right.
several weeks ago, I think it was in the Midwest, they made it known that they had a large amount of vaccines that were due to expire. And I never heard the follow up what happened with those vaccines. But then, of course, you hear about India, who desperately needed it. So how do you manage all of that?
And that's
Is
the
this something
question.
that happens on a regular basis? Is it a reoccurrence someplace else? Do we waste vaccines?
Well, sure, I'm sure we waste vaccines
Mhm.
because people say they're coming, they don't come. So I'm sure that's an issue as well.
Right.
But I think a bigger issue may well be the fact that there are countries who who are not able to get the vaccine until
Mhm.
2022.
That's
So
right.
a bigger issue is the equity in terms of vaccine for the so-called developing countries. Now, of course, India is not a developing country, but there are developing countries who don't have access to the vaccine at all. And that's a bigger issue. Yeah, it's true they waste vaccine, but there's some countries who don't have any access to the vaccine because they can't afford it.
Mhm.
And that is not addressed uh, as well. And that's something that needs to be addressed as well, so that when the vaccine is developed, how do you get it accessed by all countries? Now that becomes an issue because people are often capitalistic.
Yeah.
They want to make money.
Yeah.
But anyway, it's still an issue that equity among the developing as well as the developed countries. Any thoughts on that? Well, the fact that we have no thoughts, it means it's a problem that's enormous problem because the profit motive is with almost every country. Very few countries are talking about giving away enough to cover countries because they can't afford it, perhaps. But that still leaves countries out of the vaccine arena.
Dr. Callender, I know when I was working, I used to work with security and auditing and a couple other things. But one of the things that we had to do was we had to make recovery plans for in the event that our system went down or something was not working in accordance to guidelines. And it seems like something like that needs to be applied to like the World Health Organization, to have a recovery plan to address pandemic situations and how to reach out to countries who are not as fortunate as other countries to come up with medications and things to accommodate their needs.
Another question is this report is sterilized, and I understand it's sterilization. However, how can you get changes if it's going to remain as sterile and as not identifying countries that are accountable and requiring them to make changes? Is that possible?
Yeah, I think it's possible, but not until push comes to shove. By that, I mean, if we had a situation where there were some really aggressive variants that would cause, a significant wave in a vaccinated country. So, like, if America was entirely open for a year, but there was some strain that came out of Europe that required America to shut down again for a year because our vaccines were totally ineffective. Well, something like that would be far more cataclysmic than what we experienced just last year, and that might force us to be to develop international relationships that were more cooperative, to get beyond just capitalistic protection of medicine. But just the way we are right now, I don't think there's anything that's going to push us to make changes in having equitable distribution of medicine, not unless something far worse were to happen in the future.
That's a sad commentary, but it's unfortunately an accurate commentary. We have to be forced into doing it, and not doing it voluntarily, which is a very sad commentary. Anybody have any hopes that there's another way we could do it?
Callender, Dr. Callender, this is Chaplain Thorpe. I think they did such a wonderful job with the smallpox, the World Health Organization, and to eradicate it. Everybody was cooperating. Everybody was concerned about human beings in the third world countries and everything. At that time, they had no problems like they have now. So why can't they go back to that attitude of, humanitarianism? Let's save everybody in the world. Can we get back that spirit?
Well, the question is, does every country have that spirit? And I don't know the answer to that. I can't speak for a lot of the countries. Who can speak for China and Russia and all the other countries, and even our country? So
Exactly.
The question remains, how do we accomplish what you talked about, which is the utopian kind of situation?
We have to overcome the spirit of greed first.
Yeah.
And xenophobia.
That's a powerful spirit.
I think it goes back to what Darryl was saying about, or Dr. Walton was saying about lack of a spiritual basis in some of these countries, maybe even Russia and China, not having a higher power, over everyone, not just the rich or the politically powerful.
Yeah, well, anyway, I thought it was something that we all should know about and discuss, because it affects all of us, has affected all of us, as a matter of fact.
The question for me is, how do you get rid of greed?
Yeah, that's.
Well, we haven't gotten rid of it since Adam and Eve, so I don't know.
Yeah.
Exactly.
Well,
Change happens when people follow voices. And if you just look at what comes out of media programming about the pandemic right now, the questions that we've asked just in this conversation generally don't hear them being asked. If we had world leaders that were having the same type of conversations or talking about, how do we make this happen because we need to make it happen, that would be important. If we could get I can't name all the world leaders, but we can get them to have the same conversations out loud that we're having right now. That'd be a start to something happening.
Yeah.
Well, this report, I'm hoping, could be the galvanizing force for something like that happen. Although I'm a little bit dubious that would occur, but that in theory, that's what this release of this report is supposed to cause. But it's kind of hard to imagine it would cause that when you don't name any names and don't hold anybody accountable.
Well, we had that G7 conference in London, and that didn't work because they got together and they blamed China for their violations of human rights.
Yeah, and yeah.
Well, you need a charismatic voice like Martin Luther King, somebody that can be recognized and followed all over the world. And for that person, I currently nominate Mark Tatum. He's got that kind of charismatic voice that the world can follow, and he could be our new Moses to lead us out of this wilderness.
Mark, what you say about that?
Please don't follow me to the mountaintop because I'll get all of us lost.
Humbly stated. Well, okay, we'll change the topic, but I think this is food for all of us to think about and digest and pray about, because another 100 years is likely to recur, if not before. Now, there's an interesting article in the Post as well about, tell me what you think, what percentage of people who have, young people who have a concussion actually develop mental health problems thereafter?
I say 50%.
I'd say 44.
100%.
Any other answers?
75.
The answer is that 1/3 of young people who have a concussion develop mental health problems in the months that follow. That's 30% is pretty high, and it's I would never have thought that would. That's pretty high for me. 1/3. I mean, because a lot of people have concussions with athletic encounters.
Yeah.
Not only
Lot of
football,
mental health
basketball, a whole many things.
So if 1/3 have concussions, then 1/3 of our youth that are in sports that have concussions are mentally ill.
They're going to have mental
They're
illness.
going to have mental ill. Will that
Yes.
compound the factor when we were studying the first time that 1 out of every 4 people, and I'm looking at how many people are on here, 16, 1 out of every 4 are mentally ill? So
Have mental
more-
illnesses,
there's
mental
4
health
people on
illnesses.
this
Yes,
panel that are mentally ill.
yes, that compounds it, except it identifies how we get to that number 1 out of 4. And it makes parents wonder, how can you have your kids be healthy and still let them be involved with athletics? How do you deal with that as parents?
Did you say the mental illness comes
After.
months later or
Yes,
years later?
months.
Okay, so that means that there is hope then.
Hope for what?
Hope that the whatever mental issues that the concussion caused would eventually subside.
Well, no, I didn't say anything about subsiding. It just said that they occur. That's all. Didn't say anything about how long it lasts and all that stuff, because it's hard to get that. It just said that 1/3 of people who have concussion within months develop mental health issues. So the question is, how do you as parents handle that in terms, because most of your children, many of your children want to be athletes. How do you address that as a parent?
You know, a lot of the equipment manufacturers have updated the headgear with all these sports, and that's as a result of the concussion issue for sure. The football players have to have this special kind of helmet that can absorb some of the shock, and I think it's very important that parents make sure that the children have the headgear, the elbow pads, knee pads, all those things to help protect the children, because they see all these things on the television and want that for themselves. You know, they want to make millions of dollars, millions of dollars in sports. You know, so there you have it.
Some of the pro football players have come out and said that they would never let their children play football
Yeah.
because of the potential injuries. But also to Carol's point, Carol's question, there are several schools of thought that say that mental illness is situational as well, meaning that any of us on any given day could be certifiable, depending on the situation we're in.
I agree with that, Dr. Walton, because in my family, my brother-in-law who lives in Washington, Redmond, Washington, he played football for the Seattle Seahawks. And his attitude now is he does not want his grandchildren to play football at all. He won't let them play. So that's the parents' house. Don't let them play.
Yeah, there's no reasonable parent that should ever allow their children to play football or participate in boxing. Those are sports that are guaranteed that eventually, it's like Russian roulette. You're going to get a concussion. You play long enough. And that's permanent brain damage. And so you don't want that for your child, but you need influential voices. You need ministers. You need physicians. You need people in positions of influence. They don't let your kids play these sports. They're too much high of a chance to get a concussion.
Sports are not the only way that you can get a concussion, though. There are accidents and falls. You can, sports is what you talk about most when you think about most when you think about concussions, but there are lots of ways of getting concussions.
Sports is a choice. The sports is the choice. The accident is an accident.
That's true. But I'm saying, but the mental illness will come regardless.
Yeah. Oh yeah, exactly. Exactly. Yeah, that's exactly.
Okay, I'm looking at this panel. I only see one person that is in a parenting age range. The rest of us are grandparents. And as grandparents, we understand that when you try to tell your adult children some knowledge that you have, whether they're going to, well, first of all, they're adults and they only listen to you out of sheer utmost respect in front of your face. But, we understand telling them that, saying, I have a son, and not the one that's on here, that his sons are in the sports. And we saw this movie Concussion, and we talked about it. And Janice can allude to this, no matter what you say, it goes in, yeah, we see it, we understand it, but it goes back into that human dynamics.
But it doesn't stop us from saying it.
It doesn't stop us from saying it.
Right.
And I'm going back to that age-old question. We know things that are right and wrong, but we make that decision, and it's not always predicated upon the facts. We just
a lot of decisions are predicated on pressure. So what you do is if you can't tell your children or your grandchildren, sick your crazy uncle on them, and he won't give up until they stop and they quit, because he'll bring the heat and the pressure, and they will never play football again. So let me talk to John Tatum IV.
Okay, now we brought it in there personally. This is being recorded. You better edit that out. But anyway, okay, whether it's getting vaccines, whether it's smoking, whether it is even going to church. Okay, all you senior citizens, how well do you get to your adult children? Some of you are perfect. The rest of us are invaluable. And I'm sorry we got one young adult on here that is still raising children. Okay, that's all I have to say.
It's been done before. If you remember in the Bible, it says Jacob wrestled with the angel. That's because in that society, that was the, according to the wrestling rules, you would not get a concussion. They were protecting the brain, the cranium. There was no body slams in that wrestling that Jacob did with the Angels. And so if you are a student of history, you know that it is possible for people to recognize how fragile their brains are and to protect
Yeah,
them.
but he got his hip out of joint, and that's why they don't use that part of the meat.
You can't get a concussion
Yeah, I
with your
read the Bible too. Okay, let's go.
You're muted. Dr. Callender is muted.
Yeah, I was saying that there's some sports that they don't wear helmets, like soccer, where they hit the ball with their head, they don't wear helmets. And basketball, and just as Blaylock talked about, they have the so-called accidents that occur. And accidents are a common cause of concussion. But anyway, it's food for thought, and I think it's something for us to keep in mind. And of course, you're right. As grandparents, it's not often that you have a say in changing your grandchildren's behavior, but some grandparents raise their children, their grandchildren. So they may have a choice. But anyway, it's important to know that it's dangerous whether they will continue to do it or not. It's important for us to at least be aware of it and to recognize it.
Dr. Callender, it's also, I think, reframing the conversation too, because many sports are contact sports that aren't given that recognition. Basketball is very contact, but it's seen as a no contact sport. So volleyball the same way. So
yeah, and soccer. I mean,
absolutely.
Oh, soccer, yeah.
Yeah. Okay, John, you want to start the slides? I have some more discussion. We can talk after we finish the slides. Buchanan.
Okay.
Now, this is an article that might attract your attention. Just the title: "Hypertension worsened by commonly used prescription meds," and the most common one is the non-steroidal anti-inflammatory drugs, which along with antidepressants, and of course, antidepressants was number one, and anti-inflammatories were number two, and then steroids and estrogens. And so these are all prescription drugs that are widely used, and some of those are over the counter. The antidepressants are not over the counter, but the NSAIDs are over the counter. And I think it's important to realize if you have high blood pressure that the medication you take becomes important. I think Darryl had mentioned on another meeting that people take medication for sinus trouble, and many of those cause hypertension. So you have to be, if you have hypertension or not, you need to be aware of drugs that have as a side effect causing high blood pressure. Now we realize, of course, that pain itself causes your pressure to go up, but and so when you have pain, you have to take some medication. It's true, but it's also important to know whatever medication you take that it has its own side effects and dangers.
Callender, are we talking about like long-term use of these?
We're talking about any use, but the longer term you use it, the more likely it is. If you're going to use it for a week, it certainly is a side effect if you have hypertension, so you need to be aware of it. But any use of it causes elevation of the blood pressure. But you're in much less danger if you only take it for a very short period of time. But there's some people who have ailments that will require them to be on NSAIDs for significant periods of time. And in those situations, they need to know that so they can take medication that allows the blood hypertension to be controlled.
Dr. Callender, I got a question regarding high blood pressure. Is it hereditary? And if it is, can it be controlled by diet?
Hypertension can be hereditary, and it can be controlled by diet in some circumstances. And some of the worst hypertension I've ever treated have been in people who are very thin and who you'd never think would be hypertensive. And in those situations, diet alone sometimes is not enough, and you need to be on blood pressure medicines. But yes, it is hereditable. There's some families, and everybody has hypertension.
Dr. Callender, what are some of the common names of these medicines they're talking about?
NSAIDs,
ibuprofen,
ibuprofen, yeah, Naproxen, Motrin, and the antidepressants. I forgot all the names. They have so many different antidepressants. And of course, as we know, depression is one of the commoner mental illnesses that afflict us.
What about alcohol? Alcohol serves as an antidepressant, doesn't it?
Yeah, I guess, but that's not a prescription medication.
It's not over the counter. Over the counter.
I guess
it is. It's over the counter in a way.
Definitely over the counter. Yeah, but anyway, I think this is, and the data is pretty extensive because this next portion shows that there's a decade of data that has been looked at in many of the studies. So that it's not, the data is such that it's clear that these medications do have an impact. And it's interesting, they strong impact upon women than among men. That's surprising. And this, of course, I guess, they don't name the antidepressants, but many of them are raise blood pressure. I thought it was a good article to help us be careful of the medications we take and recognize the side effects. And if you know the side effects, then you can make the changes that are necessary to overcome it.
Talk to your doctor first.
For example, if you know you have to be on an NSAID and then you take your pressure, and if your pressure's up, you need to get medications that will control it, and also do the non-medication changes that are necessary, that stress reduction, meditation, exercise, diet, and so forth. And of course, this is a good article to follow. Who is without depression? You know, nobody rides life on a high all the time. And everybody has ups and downs. And so at some point in your life, you deal with depression. The question is, how long does that depression last? And if you have depression that lasts for longer than a day or two or a week, then it requires interaction, whatever that interaction may be. Sometimes it requires psychological treatment, sometimes it requires non-psychological treatments. But the point is that everybody has ups and downs. Right.
Sometimes you try antidepressants.
And sometimes you get prescriptions for antidepressants, right?
Now, I think it's important what Michelle did is important to be able to acknowledge it and admit it. And and avoiding the mistake that even sometimes church folks make, where we try to avoid it and we try to paint a sunny picture, but we try to paint a sunny picture all the time. But the fact that she's admitting it and kind of accepting it and analyzing it from that point of view, I think that makes it more healthy and balanced that way.
I think it's interesting that many of the high people who are in the press and as ministers, their children have had suicide and committed suicide, mainly from depression. And so Christians have depression too, so it's important to realize that everybody has ups and downs, and depression can occur in Christians and non-Christians.
Yeah.
So I think that's important. Mark or Chaplain Philip, any of you want to make any more comments about that statement I made that Christians have depression too?
Sounds like a setup to me.
Oh, sure. Yeah, sure. I don't mind talking about it. Firstly, just with my own belts throughout the years. From a Christian standpoint, the Book of Psalms has a whole bunch of heart-wrenching prayers to God. I was talking about that with my mom earlier. Just the fact that much of those prayers are from a lower place. But I think it's important to be able, I don't want to say embrace that, but just to be able to acknowledge and admit, like, when you are in a place and, yes, we still believe that we have God on our side, but just to accept where you are and accept that things will not always be sunny side up, but then to just come to take recognition of where you are and make notes and then move on from there when the time is appropriate.
So, you have any comments?
Oh, you talking to me, Dr. Callender?
Yes, you.
Oh, yes. I think from what I've heard from the patients, that as a chaplain in the hospital, they're afraid to come out and tell about, that they're feeling depression, especially the Christians, because they say they're being judged, that their faith is not strong enough. And they say that in the church, the pastors tell them, give it to Jesus Christ. He's going to heal you of everything. And they're really not getting the support and the help that they really need. That's what they tell me.
How do you deal with that when you encounter your patients whose ministers have failed them in that response, in that regard? How do you counsel them?
Yeah, I sit down and listen to what they have to say, even if it's half hour or whatever. Let them talk as long as they want to, and acknowledge that it's real. They're going through what they're going through. And then, just see how I can help them, in what way I can do, and I'm here for whatever they need me to do. And they say that listening to them is the most important thing, and to believe in what they're going through. And I said, yes, I believe in everything that you're saying, And then they have a little stigma about medications, and I told them the doctors are really good, and, and if you like, you can really get counseling if you don't want medicines, or if you'd like to try a little bit, whatever you're comfortable with. And we are here to encourage what is best for you, what you feel comfortable with, not what we want to do, but what are you comfortable with? And a lot of them respond to that. They say, it's just you acknowledging me, my pain, what I'm going through makes me feel good.
Does depression hurt?
lot of them told me that it hurts very deeply. This one young lady that you did the transplant on, Brown, Miss Brown, she died now, Sheila Brown or something her name was. And she said when her mother died, she went into deep depression. She wanted to be buried in the same casket as her mother, and opened that casket up and everything. And people didn't know what was going on in dialysis unit with her. For 2 months, her whole attitude, everything, she wouldn't talk to anybody. So Jude called me and said, Maya, please talk to Sharon Brown, So I sat down and nobody knew, so then she told me everything about her mother, how she wants to go in the same grave and everything. So, I just listened to her, what she was saying. And, I said, Sharon, I'm here, honey, for you, tell me what I can help you with, because I don't know, I need you to, and she told me, this is what is helping me, is you listening to me and accepting me of what I am. So after our talk was all over, I told Jude, she's very depressed. And we need to let the doctors know about it, so they can get her some help.
I think that was an interesting question, Dr. Callender. He said, does depression hurt? Similar to what Michelle Obama said, she said she had a quote unquote, a low grade depression. I think that there are levels to it. There are people who can be, mildly depressed and severely depressed.
Yeah.
I do believe that, at its worst, it is a very debilitating mental disease where, at its worst, at its most severe, where it can cause self-harm and it hurts, I guess, even more so emotionally to the people that are around you. Physically hurting, I think that would probably be in the case of severe depression where it's causing internal pain, or it's more psychosomatic more than anything. That would be my best guess, my best thoughts on that.
And I think what Michelle did is the best thing. She felt it. And sometimes with depression, of course, there's a stigma attached to it. But if you don't say anything, the individual, it compounds, it builds. And sometimes in our everyday life, we can identify certain individuals that have become withdrawn, something traumatic happened in their life. And just talking to them, bringing them out of that, it helps.
Yes.
Because if they hold it in, it's deep depression, and then there's a problem.
Janice, I have to agree with you 100% because they don't feel they're being accepted, and they don't feel they're being understood, and they're being stigmatized. And you're absolutely right. Listening to them, accepting them, their pain, what they're going through, they feel they feel relaxed, Yes, she understands what I'm going through. So you're right. You're absolutely right.
Yeah, just having a conversation sometimes makes the biggest difference in the world.
Yes.
Conversation means listening. Is that what you mean?
Yes.
Yeah. Listen to them.
Sometimes people think talking is conversation.
No, in this case, it's just being there. You can start it, but the whole thing is to pull that out of them.
Yes.
Let them tell you. Yeah.
Thank you. That's it. That's my experience.
This is such a common issue. That's why I wanted to just spend a little more time on it. Any other comment, Pearline? Did you want to say something?
No.
Okay.
I think what they said are absolutely right. And the stigma that comes with depression, the religious community, they really are over the board because, you got to have joy. Always joy. If you're depressed or sad about anything, like Maya, you talked about that, even funerals. If don't cry, Christians rejoice because they're in a better place. They say all the worst things that they can possibly say. We got a stigma. If you're sad or depressed about something, you don't want to admit to somebody that you are having mental problems. And
I know, right.
They want to say, snap your fingers. You're depressed because the devil got a hold of you.
That's what.
And our preachers preach it. They actually believe it.
Yeah,
That Christians should never be sad.
that's right.
And then if you
Yeah.
say, like, even Job was sad and even David was sad,
Right.
they'll say, well, that was then, but now that we have Christ, that we should
Yeah.
all be happy. We got even T-shirts
Right.
that bear the same thing,
Right.
philosophy, and then we embed it in our souls
Right.
that Christians are never depressed. And if you're depressed, then you're mentally ill and you got to go see the doctor. And so-
Carol, you're 100% right. You're
Well,
100% right what you're saying.
Well, you know, we overlook the fact that in the Bible it says Jesus wept.
Yes, yes.
They're gonna say, oh, well, he just had a little compassion. He wasn't sad.
Well, I mean, there are a lot of instances in the Bible where,
Yeah.
you know, people are depressed or sad or those kinds of things. But we as a community, I think, have, and as a society, have really swept mental health under the rug and don't want to
Right.
deal with it
You did.
because we do see it as a weakness, and it isn't. It's
Yeah.
like having high blood pressure
Right.
or heart problems or diabetes or whatever. You have an illness, you treat it. And I think that as part of what we do, we have to be real strong proponents of
Right.
people getting help.
Yeah.
And everybody that's depressed isn't down in the dumps. Some people become very manic and they're depressed. Some of the most depressed people are manic, and they mask it well. But their mental health is an issue, a real issue, and in our community, it's becoming an even greater issue, and we've got to do something about it.
Yeah, our prayers and testimony reflect it. I woke up in my right mind. And I take no medications. That means the Lord has blessed me tremendously.
Yeah.
He didn't bless you because you didn't wake up in your right mind and you take a pill.
Right.
Oh, I take no pills. I'm in perfect health.
Right.
So the Lord has blessed me.
Okay,
So
I
true.
think we've got a good opportunity to discuss it because it's worth it. It's something that is very prevalent. This is interesting that they have more clotting cases with J&J, although 28 cases is not a lot when you think about how many millions have had the vaccine, but still, it's still 28 cases. And they have identified, as we talked last time, about some predisposing causes, but it's still occurring.
Dr. Callender, when it first started, the clotting issue first came up, it was all women. And now I understand that out of these next several cases, some have been men.
That's correct. Yeah, to no surprise though. I am surprised that it's not associated with with the Moderna or the Pfizer, although as Buchanan has said many times, it's a different kind of vaccine. It's interesting. This discussion has been going on for at least the last year about COVID being transmitted through aerosols, and we've discussed it many times here as well. And I think that these discussions will go on because, especially as it relates to indoors. Outdoors is another question, but indoors is something that is a concern. And the aerosolization of the virus is a concern.
The question I have is viruses like coronavirus and the way that they spread. Okay, one way they spread is, as you point out, aerosols in the air, but more so indoor aerosols. And they also, because we are wearing these masks and everything, it's obvious that the virus spreads through people's breath.
Yeah.
So, my question is, in the beginning of this pandemic, how did that thing spread all over the world so fast? Was it the aerosols in the air? Was it people's breath? Or what was it?
People. As a matter of fact, in that study that in the Washington Post, they talk about that. It's human to human transmission. There's no question. It's just that it wasn't communicated, but it's human to human transmission.
Yeah, so I've heard, just to back that up, I've heard that, the flu and the cold has gone way down this past year, and that's because of the habits that we've been told to practice. Washing our hands, staying 6 feet away, wearing masks. So if you think about it, before then, we weren't doing it as aggressively as we're doing it now. So so it spread that fast, it spread that quickly because it was our normal human practice to be in each other's airspace and to not wash your hands as frequently and all that sort of thing. So things have tapered down significantly because of better habits. And it spread, but to answer the question, I think it spread because we were used to just being each other's airspace all the time.
Yeah, and that's a good point because we were in each other's airspace a lot before we even knew that there was a virus and that we could be spreading it.
And if you think about the dense populated areas, either our country or other countries, India, China, where you know public transportation and mass transportation, where people are just huddled in together in masses, that's even more so. So that that's just another way of just super spreading the contagion.
And all that was happening before we even knew we were spreading anything, before we even knew that there was a pandemic.
Mm-hmm.
Right.
When is it going to be safe to go back to church and have your choirs? Carol, when are you starting to have your choir practice again?
Nobody's hired me yet back. But,
Say that again.
Nobody's hired me back yet, but I think they're still having praise teams and soloists and everything like that. I've heard that churches are planning to open up soon, but nobody has talked about the choirs. They're still having praise teams and soloists. Anybody on this panel, their church is opening up with choirs? I haven't heard of it.
Well, I got several communications this week trying to find out about interest in returning to choir. And so it's coming up because remember, as of Saturday, Maryland is going to be open for everything. And as of the 21st, DC is going to be open for everything. So that this situation is going to be more and more a discussion point. And the problem is that choirs sing indoors and exercise classes are indoors. And so this is something that becomes imminent over the next couple of weeks.
Well, anybody on this panel that's in a choir that wants to go back, could they say that? I know 2 or 3 people singing choirs at their churches. And Dr. Callender, you sing in your choir, and I know you're minister of music. Are any of you willing to go back to choir rehearsal right now?
Well, they didn't ask that question. They asked, "Are you interested in singing?" But that's the real question, Carol.
Yeah.
Are you
Sylvia,
willing?
are you ready to go back?
I would say if everybody had a vaccination card and were vaccinated, then I would consider it.
You would consider it. Dolores, would you go
No, I would say
No,
no. I would say
I'm like
right
Dr.
now.
Callender. I would consider it if I knew everybody was vaccinated, had their vaccination card. But
As of right now,
Yeah.
no, ma'am.
And as of right now, for me, no. As a matter of fact, I was thinking about the mask, and when this is everybody's been vaccinated, knowing that the flu was not as prominent as it was because people had the best habits in terms of wearing masks and washing hands. And I'm thinking like, during the school year when flu season start, they should be saying, keep your child in a mask, in the schools, and I'm going to wear a mask during flu season. And so I don't think masks are going anywhere.
Right. I think so.
I agree.
I agree with you.
So just looking at the two, and that's arbitrarily, majority of the people that I've talked about, the knowledgeable ones, they're saying no. Now, I'm not talking about the ones that participated in the praise team throughout. They would quickly acquiesce and say yes, because they've already done it. The ones that are on YouTube and Facebook,
Yeah.
the ones that have been singing all along, and the mask, they take their little mask off, sing, and then put it back on like all of a sudden they got immunity from singing without the mask. I never understood that philosophy either.
According to the CDC, if you're indoors, you have to have a mask on to be safe.
Oh.
Period. Singing.
Well,
or
John,
not.
you've looked at church services, maybe you have or haven't, but every time you see them, they all have their mask off while singing. I don't care whether it is, I'm not going to mention all these different churches, but everyone I looked at, they take their mask off to sing and then they put them back on.
Yeah. Yeah. Well, that's going to be the timely topic for the next month.
Look, so we need a choir. We need a choir that sings with a mask on.
Yeah.
Period.
Yeah, that's a good one. Yeah.
Oh, I mean, how would that? I don't know the acoustics, Carol, but and I remember Bonnie had mentioned she sings and it comes across real clear, and she wears 2 masks. So
wow.
Maybe that might be the thing in terms of masks while you sing.
Dr. Callender, I have a question for you. Now, they said the Reds, not the Redskins, the Washington football team, the game is in September now. So do you wear masks to that to the event at the FedEx field, or what do you do?
Well, I know right now, Doc, because I'm going to my 4th game at Nats Park. You have to keep your mask on, even though you're outdoors, unless you're eating or drinking. You can't eat or drink anywhere in the courtyard area. You have to eat only at your seat, eat and drink at your seat, and otherwise you have to have your mask on the whole time.
What month is that?
Now.
Okay, but I'm talking about September for football game.
We don't know about September because we don't know. See, for example, in Maryland, they say if you have a 70% vaccination rate, they're going to open up everything. So, so if you have because they believe in herd immunity. So if everybody's vaccinated, just about all the restrictions will be lifted.
Okay.
Yeah, I'm back at band rehearsal, and we have a mask on. I have a mask with a flap over my mouth, so I can put my mouthpiece in and bring the flap back down with this mouthpiece in my mouth while I'm playing my horn. Pretty wild, but it's worked so far.
Say, John, let me share the screen for about a minute, if you will.
Go ahead. Okay, hold on.
I wanted to, and you can bring that back in a second. What I wanted to do was, my church has some guidelines, and I wanted to ask Dr. Callender about one of these guidelines. If you can see my screen.
Yes.
Thermometers. It says in dark and bold writing, if your temperature is 101.4 or higher, you will not be allowed to attend service. What about that figure?
That makes sense. You should be under the doctor's care if your temperature is that high. You don't belong in church. No, I agree with that.
Okay, so what about a temperature of 100?
That's different. That's,
Okay,
I don't have any problem with 100.
okay.
101 is fever. Are you sick? You need to be under the doctor's care. That's a pretty high temperature. That's not even discussable. That's too high. So they took a safe way. They put it so high that if you're at that temperature, you're sick. So when is your church talking about opening? Yeah.
They're going to talk about it. They talked about it last night.
Oh.
I didn't go. I didn't see. But they're going to open up on June the 12th.
Oh, that's plenty of time.
The mayor said all churches can open up by June 12th. And
That's reasonable.
Yeah, June the 13th is the next Sunday.
I see.
First Sunday that churches can open up. But these are our guidelines for our church. And the seating capacity says 50%.
That's currently, yeah, right. But that'll change too. Any comments about it? It looks pretty safe.
Yeah.
But it doesn't say anything about choirs.
No.
But I do think that, we have a choir law. I think if people wear their masks and sit 6 feet apart, that'd be okay.
Only set the choir loft is only 6 feet.
The other thing is the drummers don't have to worry about a thing because they're inside of a fiberglass cage with a lid on the top. So they can go back to church and drum all they want to. John Buchanan plays drums.
Oh yeah, sure he does.
Yep.
I don't have a fiberglass cage though.
Yeah.
Yeah,
That's right.
At Carol's church, they have a fiberglass cage. It has a door for the drummer to get in and out, and it has a lid on the top of it.
Really?
Yep.
John, at our church, are they building a cage for our drummer?
No, because they haven't really been complaining about the drums being too loud. They haven't complained about that.
Well, I thought it was for health reasons, not the.
Oh no. Yeah. This was long before.
Oh yeah, I know they started it long before, but I thought you were making reference to it according to the health guidelines, but.
No, the health guidelines mean that now the drummers are even safer now.
Yeah. Yeah. That's why I was asking you, were they planning on building one for our church?
No, they're not.
Okay.
Because see, the problem with our church is they're not even ready to bring the drummer back. And the bass player. They don't want the they're hard pressed to bring any other musicians back except for Michael.
Hey, John.
Michael.
Okay.
He said Michael. Michael, yeah.
What about the piano and the organ?
The organ player is 12 feet apart from everybody, so they're okay.
Why?
The organ is so far away.
Oh, but piano and organ are not transmissible.
Right.
They're not thought to be transmissible.
Piano is okay. Piano and organ is okay.
Yeah.
I think at our church, Betty, the piano and the organ, they're about 16 feet from each other.
Yeah. Yeah, they got plenty of distance between them.
Yeah. So yeah, piano and organ is okay, Dr. Young.
Yeah, okay.
So I'm going to, if everybody's finished looking at this, I'm going to stop this share.
Send that to me, John.
Okay, John.
I think if you, excuse me, if you are not getting emails from Addie, I will send it to you.
Okay.
This is interesting article about genetically modified mosquitoes in order to reduce the spread of diseases such as you see here, yellow fever and Zika virus. It's not for COVID, but those other diseases. And I think that's an interesting way of handling it. This fits your love for hybrids, Darryl. We really gotten carried away with ourselves to have genetically modified insects to keep to have them mate and reduce the incidence of the viruses. It's interesting hypothesis.
Oh, my goodness.
Can you imagine it passing a gene that kills female offspring before they mature?
Oh, my gosh.
Well, I tell you,
Oh,
we think of everything. Huh?
can't believe this.
You know, the only problem with this is what happens if something happens that we don't anticipate. There's another mutation that occurs,
Yeah.
you know.
Well, it's
Wow.
it's an effort to overcome. You know, we think we know everything. So
Well, when God said, be fruitful and multiply, was he talking about mutations?
no, but when he put up the Tower of Babel, he knew what he was doing. Wow.
Confusing the languages?
Yeah.
So we couldn't communicate with each other.
Right. That's right. He said, next thing you know, they'll be trying to get up in heaven. Sure enough, here we are.
Yeah.
You know, dengue fever, I think it happened down in Central America. The research that they used to genetically sequence the dengue fever, that's the same techniques that they use for COVID.
Right.
And that was like 12 years ago.
Wow.
So they developed that, and dengue actually got into Florida. Oh, it says Key West. Oh yeah. It got up from the Central America all the way up into Florida, but they had the treatment for it by the time it got up there.
Yeah, it's exciting times that we're living in. I hope my audio doesn't cut out. John says I've been having some audio problems, but we're on the cusp of developing cures for things like cancer, just a variety of diseases, and we can develop them really quickly. I wish I was 44 years old because, maybe that means that we could develop the fountain of youth through technology. People that are 44 might live to be 404. They're going
Dream on, Darryl.
to do all of this the day after all of us old heads have passed on.
Yeah.
Well, you're right, Darryl, because they found a cure for hepatitis C, and those people who had hepatitis C back in the early 90s, they were born too soon to get the benefits of it.
Yeah.
This is an article that just talks about those people who develop neurological complications, which are significant in number. You see here, 82%, and six-fold increased mortality risk. COVID is a deadly disease.
Oh, it is.
And it makes you wonder why people would not want to take the vaccine. But anyway, especially if after disease you have long-term neurologic problems. But as they say, there's no accounting for taste. So some people will, in spite of everything, still refuse to take the vaccine for the reasons that we've discussed ad nauseum. But recognizing how important your brain is, I wonder about those people who don't want to take the vaccine. But
No, sad.
Yes.
Very sad.
and especially since more men have the problems than women. But no. Do you still encounter a lot of people who don't want to take the vaccine?
Dr. Callender, I had a friend that she developed eye problems and double vision.
Ooh.
And it might have been, she thought it might have been age or whatever, because she's up there with us. And I asked her about it the other day, and she said, lo and behold, that the optometrist or ophthalmologist thinks it was a reaction to the Pfizer vaccine, that it's not happening with her anymore. But I'm sure she's glad she got the vaccine.
Yeah.
Is the problem gone now, or?
Yes, it is.
Oh, that's wonderful. Okay, good. It's interesting. Also encountering a number of people who have very strong reactions to the vaccine with a lot of side effects. Remember, we had seen some articles that said that suggests that you may have actually had the disease in the past. But the only new thing that I read is that somebody was testing John Tatum's hypothesis, because John Tatum said last week that he thought that after they got the second dose, the transplant patients would still wind up having less antibodies than other patients. And that's what the tests have confirmed so far, that transplant patients are not as strongly immunized as other patients. And so the question is, what do you do about it? But John, you should know they did confirm that after the second dose, the transplant patients still did not have the same high antibody titer that other patients did. Now, this is one thing that I can't understand about Republican rage. Now, we've lost, 500,000 patients from COVID. But he's claiming that we've killed millions of Americans. Well, we haven't killed 1 million Americans. So what is he talking about? I mean, it's interesting. The same kind of fake news that they had with Trump, they continue. They even got rid of the Republican who voted to impeach Trump. So that it's interesting how the Republican Party, they love Trump, still love him.
Yeah.
They don't like the truth necessarily, but they continue to use mistruths of false truths.
I saw in the newspaper that the Democrats are upset because they don't want the country to go into a one-party system, and they say they need the Republicans for a two-party. And if you think about that, if we go to a one-party because the Republicans just destroyed themselves about this internal strife, leaving a lie, then we're only left with the Democrats.
No, you got independence.
Huh?
You have independence.
Yes, oh yes, we have independence, but as far as money and independence and you can't gear independence with the Democrats and Republicans. You could say we have a three-party system, but in essence, we really only have a two-party system. And to get rid of the Republicans, don't you think that would be detrimental to our democracy? Or what do you think?
I think it's good to have a strong second party.
I kind of see the programming behind that. I think the way this world is set up is that they want to give us a choice between two decisions. Because even overseas in Jamaica and some of the Caribbean islands, you know, they have like a red party and a blue party. You know, we kind of go between, you know, black and white, Pepsi or Coke. You know, they seem like society pushes us to try to make a decision between two things, like all the time, even when it's not necessary. So, you know, yeah, I know a one-party system seems scary, you know, but again, for me, for where I'm sitting, what's also scary is how society always wants to get us to choose between two different things all the time, when there could either be more or there could be one. But then again, that's just how society goes.
Yeah, you know, the other thing too is I like the two-party system as well, because a one-party system is, I think, is identical to communism. They have one party and that's it. And so when you go to the store, and this is part of capitalism, you go to the store, and like you're saying, Mark, they want to give you a choice. And so when you're shopping, you say, well, should I buy this loaf of bread at this price, or should I buy that loaf of bread at that price? They always want to give you a choice. And a lot of people, if they want to save money, they'll take the cheaper one.
Right.
But they always give you a choice. It would be horrible, I think, in this country, because we're not used to it, to go to a store and just have one choice on everything.
Well, I guess just as a Christian, I believe in the utopian society that, you know, when Jesus comes again and in return of his kingdom, that'll be the best one-party system on the planet.
Oh, yeah.
But yeah, if left in man's hands, yeah, I don't like. Yeah, I know what you're saying. I don't like the one-party system if it's in man's hands, because it could, you know, that's what I think about the New World Order and one world system and all that sort of thing. But until then, you know, again, they make us choose between two, Apple or Android, and Pepsi, Coke. You know, it's always two.
My opinion on the Republicans, I kind of believe the Republicans are at the point where they're going to end up being two separate parties.
Yeah.
So we're going to end up with a three-party system rather than a one-party system.
Yeah.
Right now.
I think eventually it's going to take a while, but I think those Republicans that have been around for any length of time, or who embrace Miss Cheney or Congress, her ideals and the truth, I think they're going to just split from that Trump part eventually, and it'll be three parties. Maybe not as strong, maybe like an independent.
Yeah.
The independents, but I think that's what they're headed for.
Yeah, I heard they'll run for president.
What's really frightening is the fact that the remaining Republican Party will be more pro-Trump than ever before.
Yeah.
That's scary.
Yeah, I got issues with the use of the media with this false information. They're putting out the statement here that says Fauci is the director of the National Institutes of Health.
And he's never been the director.
That's what Navarro says. And they're accusing him of funneling $500,000 to the Wuhan Institute, where the virus was, they said, was developed. So they're trying to accuse Fauci of taking part in creating the virus. Can you believe that?
Well, but how can you talk about false news? Fauci has never been the director of NIH.
No.
Right.
Well, Fauci shot down Rand Paul
Oh, yeah.
this week.
Yeah.
I mean, really cut him to shreds in a very, very nice and dignified way. But
Yes, he did.
yeah, because Rand Paul repeated the same thing.
Yeah.
Mhm.
Well, I think this will be the last article because it's 10:30 already. So
Dr. Callender, I'm
yeah.
sorry, but you didn't talk about the children. They're being immunized since yesterday, 12 years old to 15.
Right. Okay. But that was the last article. So why don't we just go back to the slides? We can talk about that if you like.
Oh, okay.
Yeah. They approved the vaccine for 12 to 16. Yeah. So which is good for the teenagers and children up to 12.
My granddaughter's getting her first shot today.
Oh, okay.
Good. Good.
Yeah. How do you think this is going to impact kids going back to school?
Well, if you look at the statistics, there's still a significant percentage of parents who say that they're not going to allow their children to get the vaccine. So
Yeah.
So I think it's also going to depend on district-wide mandates. For instance, so my eldest son has been accepted and is going to Clark Atlanta in the fall. So we're happy about that. And I heard that Clark Atlanta is one of the schools that are requiring their students to have a vaccine. So he's got to get on the list for that. We do have a 12-year-old also, but so far, the districts haven't said anything about requiring the vaccine, but I feel like that might be coming down the pike. So I feel like, parents, they might fall in those gaps. Like if it's not required, they probably won't do it.
Right.
If it's required, then they probably will need to or have to do it.
Yeah.
and there'll be a rash of lawsuits also.
Well, that's my situation with my grandkids. Their parents, my son and daughter-in-law, do not want to get vaccinated. But the school that my grandson is going to in the fall, he has to be vaccinated. Okay, they're going to do that, but they still see no need for them to be vaccinated. Crazy, but you can't convince them, at least not for now. Not for now. I did let my daughter and my granddaughter in my house a couple of days ago. Of course, I had Lysol everywhere, but it had been about 4 or 5. They're negative. They're negative, but I feel I'm not secure.
Yeah.
AIDS, respiratory problems.
Right.
You're hesitant, and I have been vaccinated.
Yeah.
Yeah, you do not want to get COVID, period.
Do you think the teachers are going to make the kids that have their shots sit on one side of the room and the kids who haven't had their shots sit on the other side of the room?
No. What happens every year, I know particularly at the last school that I worked at, they always have a list of shots that the children must have. It's for high school. If they don't have it, the school nurse notifies the family that your shots are not up to date. They give them so many days, and then after that, they are suspended from school until they get their vaccination. So if they do the same thing with COVID, you always have those few that haven't had it, but they'll be suspended until they get their shot. So that is not a big deal. That happens even with the regular inoculations. You always will have those few that didn't get it, the parents, or they lost track or something like that. But once the school's mandated, there's no big deal about it. The parents know if I'm going to send my kid to school and get them out of the house so I can go to work, I got to get them their vaccination so I can go to work and make money.
The thing about the suspension is that it's not going to matter because that means they have to stay home. They're going to learn virtually like they've been doing.
Well, there's no more virtual.
It's always going to be virtual.
Well, they said in New York or someplace, that they will not have school days. I believe it's in New York. They will not have school days anymore any longer. Because if there's a school day, that they're going to have virtual learning in lieu of not coming to school. So since this virtual learning has taken place and they find out the school systems can do it, everybody got the computers anyway. So if you don't come to school in person, you'll do your virtual learning. But that's a hardship on parents because they got to stay at home, maybe, and monitor their children, maybe.
Yeah.
So they're going to do everything that they can in their power so their child will go to school. So as teachers say, free babysitters, but it's only that it's our whole economy is result upon children going to school so parents can go to work, which they got to go to work so they can sustain life as we know it in our culture.
I think the future holds for us. There's always going to be hybrid learning. Some people are going to be in school in the classroom and others are going to be at home.
Now there's a gap in the learning now, and
Yes.
they found out that the kids are not learning the way they have in the past, and they're trying to make up for it with summer school and other ways because the online learning is not as effective. I don't know how you can teach chemistry and have chemistry experiments and biology,
That's right.
hands-on with material. You can't do that at home. Sorry about that.
Right.
And I thought in this area in September, all school is no longer virtual. You have to be in the school.
Good.
Chaplain, closing comments as we close up today?
Yeah, I just want, since it's all new, yesterday, none of us know about the little children, especially 12 to 15. Let us keep them in prayer. I want our children to be safe with the vaccinations. No, no any kind of trouble or side effects. They'll be all nice and happy and bubbly, blessed. They'll be blessed to go back to school and they'll be safe.
Okay. Well, we'll see you all next week. Thank you for.
Oh, this is Darryl's last time for 3 months.
Oh, yeah.
Oh, that's right. Yeah.
Darryl, I'm going to miss you going back to work and your
We'll
son.
all miss him. We'll all miss
Yeah.
Darryl.
Glad I caught you.
I will miss you all.
And I love your background.
I know.
Don't worry, Darryl is going to be working.
Almost celestial.
Darryl,
Going to heaven. That's
Heaven's in the background.
Darryl, you're going to turn your job into a virtual job, right?
No, I'll be talking to people on the phone. That's
virtual, yeah.
Virtual? No, just working from home, but it's a real job.
Yeah, working from home. That's
okay.
what I'm